One of the things that St. Boniface has embraced quite well is this idea of lean transformation, or using technology from business to improve efficiencies of care. Part of that process when we do a lean initiative, which is a process of looking at a problem and sorting it out, is identifying what's value added. And value added is not just to the team, but also the patient and the patient's family. And through this process, we've engaged patients and their families to say, well, what actually matters to them? What do they want? Is it the fact they're in a bed space and have all the monitors hooked up, or is it something else? We always looked at the former. Okay, well, how can quickly we get someone into a bed space, in the ICU, get them sort of tucked in from a nursing perspective, and then start a business of recovering them? They care about that, but they care more about having their loved one at the bedside. And so we determined that was a value added. So we went through the process saying, well, what was our current state of how long it took a family member to come to the bedside after the heart operation? And when you follow this, it could be as long as 4, sometimes 5 hours. And again, we didn't have any idea that's how long it took, because we've never really measured that before. So once we identified that problem, we sought to tackle that. So what we do now after heart operation, we identify where the families, the patient's family members are. The surgeon goes out and speaks with them first and tells them that the patient's coming to the ICU to set the stage of what to expect. Once the patient is settled into the ICU, then we start the clock to see how long it takes to bring the patient's family in. And we've reduced that from about 4 hours down to about 40 minutes to an hour at the most is what we're trying to achieve. It's still pretty long, but it's sometimes the best we can achieve based on the nature of coming to the ICU and so forth.